Hi everyone, today I'm going to be presenting to you ADHD, which is also known as Attention Deficit Hyperactivity Disorder. So just sit back, relax, and I hope that you enjoy this video. Do you know what ADHD means?
Attention Deficit Disorder.
Okay, have you ever seen a child that was diagnosed with ADHD?
Oh yeah, I've seen lots of them.
What does it look like?
Look like their pants are on fire and they can't sit still. They got to move all the time.
I think it means like attention deficit disorder. That's all I know.
Yeah.
Retardation, that means though.
Hyperactivity.
Okay. Just like anxiousness.
Uh-huh.
A lot of movement.
As you can see, most people have a slight hint as to what ADHD means, but the majority of people don't understand what this disorder all entails. ADHD, Attention Deficit Hyperactivity Disorder, refers to developmentally inappropriate degrees of inattention, impulsiveness, and hyperactivity. ADHD affects every aspect of the child's life, but is most obvious in the classroom. Early identification of affected children is important because the characteristics of these disorders significantly interfere with the normal course of emotional and psychological development. Meet Lance, a vibrant 7-year-old who was recently diagnosed with having ADHD. Soon we will learn how this disorder not only affects him, but also affects those around him, his family and friends. What's your name?
Kennedy.
All right, Kennedy. How old are you?
10.
10. And who are you to Lance?
I'm his oldest sister.
Okay, Kennedy, do you know what ADHD means?
Yes.
You do know what it means?
Mm-hmm.
What does it mean?
I forgot what the words mean, but I kind of know what it kind of means.
You don't know what the letters mean?
Mm-mm.
Okay, what do you think it means to you?
It means that you're special.
It means you're special?
Yeah.
Do you know if your brother is affected by this at all?
No.
You don't think he is?
Well, sometimes. I mean, he doesn't want to eat. He doesn't want to eat.
Many children with this disorder develop maladaptive behavior patterns that impede psychosocial adjustment while they try to cope with cognitive dysfunction. Their behavior evokes negative responses from others, and repeated exposure to negative feedback adversely affects their self-concept. The characteristics of ADHD affect the child's written and adaptive skills, as well as their social status and self-esteem. Can you tell me your name and how old you are?
Lance, and I'm 7.
What does it mean?
Something's wrong, and not something's wrong, but you don't know when to stop when you're doing something, and you don't really pay attention.
Oh, it's a good description of it. Not only does ADHD affect the person, but also affects their parents and loved ones. So far, we have met Kennedy, Lance's older sister. Now, let's meet his mom and hear from her perspective.
My name is Jamie Alford, and I am the mother of Lance Alford, which is the subject of our discussion.
Now, Jamie, you told me that Lance has recently been diagnosed with ADHD.
Yes.
And how did you find that out?
Interesting enough, by a friend. I have a friend that her 2 sons have ADHD, and he was having a lot of trouble in school as far as discipline.
Okay.
And I noticed that he was getting some very bad grades in his reading and not really paying attention like he should. So I went ahead and took him to the doctor and had him diagnosed.
Some of the things that they were saying in his disciplinary reports.
That he was getting up out of his seat when he's not supposed to. He was talking when he wasn't supposed to. He was not paying attention. Okay. She would call his name 4, 5, 6 times, and he wouldn't acknowledge her. Okay. Of course, when the group would do something, he would be off playing and doing other things, not paying attention. That was most of the reports that I received.
Okay, so what do you think this means for you, Lance? How does this affect you at school?
I don't pay attention, and when my teacher's talking, I don't answer, and then she calls me again, and then I'm like, wait, I didn't hear you.
So you have a hard time paying attention?
Mm-hmm.
Some children with ADHD even come to have learning disabilities. This means that they may have difficulties in the acquisition and use of listening, speaking, reading, writing, reasoning, or mathematics skills. Okay, how do you think this affects you at home?
I don't know.
You don't know how it affects you at home?
Uh-uh.
Do you have a hard time following rules at home?
Sometimes.
Sometimes. Do you find it easy to complete tasks that you begin? For example, if your mom tells you to clean up your room, do you do it all right away?
Sometimes when it's little.
When it's little. So it's easier for you if
Like
the task is
this.
small? Management of the child with ADHD usually involves multiple approaches that include family education and counseling, medication, proper classroom placement, environmental manipulation, and behavioral therapy or psychotherapy for the child. Interventions for children with LD are primarily educational. As far as pharmacologic therapy, the most frequently used medications are the psychostimulants, Ritalin, Dexedrine, and Vyvanse. Other medications include the mixed amphetamine salts, Adderall, which are available in extended release form. As far as treatment, are there any type of medications that Lance is currently taking?
Yes, he is taking Vyvanse.
Okay.
The reason I picked that is because it's a very fast-acting medication. There are several out there. There are some that take probably 2 to 3 weeks to work and stay in your system for a very long time. But this one starts in the morning, and throughout the day it lasts, and then by the evening it's out of his system already. Okay. So that's the main reason why I picked that one.
Vyvanse.
You take Vyvanse? Yes?
Yes.
Okay, and how does that make you feel?
I don't really know.
And what kind of signs and symptoms do you notice with Vyvanse?
It definitely makes him more calm. He's less combative. He's less argumentative with adults, which I've had a very hard time with. He has less of an intent to be right all the time, which he wants to be. So it's definitely more calm. I find that he is a lot more emotional. He has definitely more outbreaks, which is frustrating. But his tummy ache, he did right at the beginning, he gets headaches and stomach aches. But after I had him on him for about a week, that seemed to subside.
So he has like unstable mood swings? Okay. Do you have any side effects? Like, do you ever feel anything after you take it?
I have sometimes headaches in my stomach.
Psychostimulants cause an increase in dopamine and norepinephrine levels that leads to stimulation of the inhibitory system of the central nervous system. Children are given a small dosage initially, and the dosage is gradually increased until the desired response is achieved. Children who receive these stimulants should be monitored carefully for the development of tics during initial treatment, and stimulants should be avoided in children who have a history of tic-like behaviors, a family history of Tourette syndrome, or ADHD combined with TS. Many of the stimulant drugs are available in short-acting and long-acting form to better meet the child's need for therapeutic management. An additional consideration in the administration of medications is the child's ability to swallow pills. Since some come in capsule form, they can always be sprinkled on applesauce. It is important to remember that these medications are not prescribed based on the child's weight, but on resolution of the symptoms. Therefore, it is important to follow the child closely and evaluate for therapeutic effects as well as potential side effects. Parents need to be informed of the possible side effects of medications. The psychostimulants have similar side effects that include weight loss, abdominal pain, headaches, decreased appetite, sleepiness, and increased crying and irritability. The use of caffeine decreases the efficacy of these drugs, and insulin requirements may also be altered. If decreased appetite is a concern, giving the psychostimulants with or after meals rather than before, encouraging consumption of nutritious snacks in the evening when the effects of the medication are decreasing, and serving small frequent meals with healthy on-the-go snacks are helpful interventions. Sleepiness is reduced by administering medication early in the day. So as far as his diagnosis goes, what did that process entail?
The only thing it entailed was a form that
Okay.
I filled out and his teacher filled out.
Okay.
Which I feel is not adequate enough. I guess being around the medical field for a very long time, I'm used to let's do a scan, let's do blood work, let's do something that gives an accurate diagnosis. And I feel that this is extremely subjective, and it is very frustrating because I don't know if medication is right for him, but we started, so we're just going to go that route for now and see what we can do.
No one knows exactly what causes ADHD, but certain things are known to play a role. ADHD is believed to have a genetic link. Anywhere from 1/3 to 1/2 of parents with ADHD will have a child with the disorder. There are genetic characteristics that seem to be passed down. If a parent has ADHD, a child has more than a 50% chance of having it. If an older sibling has it, a child has more than a 30% chance. At times, this lack of unknown etiology can leave the family frustrated during the diagnosis process. The diagnosis is established based on the APA's Diagnostic and Statistical Manual of Mental Disorders, Characteristics, and a thorough evaluation. It is important to emphasize the need for a complete and thorough multidisciplinary evaluation of the child. The clinicians and professionals must first determine whether the child's behavior is age-appropriate and truly problematic. A history, both medical and developmental, and a description of the child's behavior should be obtained from as many observers of the child as possible, especially the parents and teachers, along with the health professionals involved.
Now, as far as diagnostic tests, do you remember taking any type of test to discover that you had ADHD?
Yes. They had to put these little sticky, really, really cool things on my stomach and my chest. And then they had to just see, there's no needle, it didn't hurt.
A physical examination, including vision and hearing screening, and a detailed neurologic evaluation will help rule out any severe neurologic disorder. Medications, what other kind of treatments?
I take him to counseling once every 2 weeks, and this is not just a counselor where he sits down and talks to her. It's actually a play therapist.
Okay.
And that seems to help tremendously.
Do you see anybody that you talk to about your feelings about this disorder?
I play. Sometimes I talk to her. I go in her room and then it's playing, and then you go in there and then you play with toys, and then we talk about mad, sad, and then there's a sign, and then there's a lot of toys.
Behavioral therapy focuses on the prevention of undesired behavior. The nurse should help families identify new appropriate contingencies and reward systems to meet the child's developing needs. They may also receive instruction in effective parenting skills, such as delivering positive reinforcement, rewarding small increments of desired behaviors, and providing age-appropriate consequences. Use of organizational charts for completing self-care activities and use of a word processor instead of manually writing assignments are emphasized. Through collaborative teamwork, parents learn techniques to help the child become more successful at home and at school. The results of several studies suggest that multimodal treatment involving the use of pharmacotherapy and behavioral intervention, as well as close-up follow-up and feedback from school personnel, is more effective than intensive behavioral treatment alone. Classroom placement. Children with ADHD need an orderly, predictable, and consistent classroom environment with clear and consistent rules. Homework and classroom assignments may need to be reduced, and more time may need to be allotted for tests to allow the child to complete the task. Verbal instructions should be accompanied by visual references such as written instructions on Blackboard. Regular and frequent breaks in activity are helpful because sitting in one place for an extended time may be difficult. Computers are helpful for children who have difficulty with writing and fine motor skills. In such children, handwriting will not improve. They need to find alternatives to physical competition that requires coordination of movement. When it comes to the prognosis for this disorder, with appropriate intervention, ADHD is relatively stable through early adolescence for most children. Some children experience decreased symptoms during late adolescence and adulthood, but a significant number of these children carry their symptoms into adulthood. The goal for children with LDs is to help them identify their areas of weakness and learn to compensate for them. Have you noticed a difference in his behavior since he's begun therapy and his medication regimen?
I have. After the symptoms subsided with his tummy ache and headaches and stuff, he's definitely less combative. So that when I do tell him no, he doesn't ask questions, or he's not argumentative towards me or to other adults.
As a parent of a child with ADHD, how does that make you feel personally?
At first, I was really hurt and upset, thinking that I had let him down in some way, shape, or form. Until I started doing more research and really understanding the physiology behind ADHD is when I started to understand that there's nothing I could have done, but going forward, I can do what the physician has basically described as something that would be good for him.
Nursing care management. Nurses, especially school nurses, are active participants in all aspects of management of children with ADHD and LDs. Nurses in the community work with families and school personnel on a long-term basis to help plan and implement therapeutic regimens and to evaluate the effectiveness of therapy. School nurses often understand the child's special needs and work with teachers. Management begins with an explanation to the parents and the child about the diagnosis, including the nature of the problem and the practitioner's concept of the underlying CNS basis for the disorder. Most parents, like Jamie, are confused and feel some measure of guilt. All parents need the opportunity to vent their feelings and suspicions. The health professional should focus on building self-esteem by encouraging the family to focus on developing the child's strengths, rather than just weaknesses. Children and adolescents with ADHD are at increased risk for accidents and unintentional injuries because of their impulsivity and decreased judgment of dangerous activities. Therefore, measures should be taken to protect such children from personal injury. Always caution parents to keep these drugs safely stored away from young children who may inadvertently ingest them and adolescents who may abuse these drugs.
How do you feel having this? Do you feel any different being diagnosed with ADD?
ADHD, no.
No? Sorry about that. You don't feel any different? No? You're still a happy boy? Okay.
Parents need information about the prognosis and an understanding of the treatment plan. The greater their understanding of the disorder and its effects, the more likely they will be to carry out the recommended program of therapy. It is important that they understand that the therapy is not necessarily a panic and that it will extend over a long period. This has particular significance for changes they need to make in environmental management. Reading material to help the child and family can be obtained from a variety of sources. And as you all can see, with proper management and treatment, the child can begin to lead a more positive and enriched life despite this disorder. I sincerely thank you all for your patience in watching this video. I hope you all receive some good information from this, since of course, this will be on the test.
Okay. What about paying attention to your parents' roles? Do you have a hard time doing that?
Now please feel free to ask any questions that you may have. Thank you.